Good evening, and thank you for joining tonight's telephone town hall meeting hosted by Jefferson County Public Health and Jefferson Center. I'm Roger, and I'll be your moderator tonight as we talk about maintaining mental health and well-being during the coronavirus pandemic. Our presenters include Dr. Mark Johnson, Jefferson County Public Health Executive Director, and Jefferson Center CEO Kiara Kunzler. We also have several experts who will share mental health and wellness tips as well as local resources to support the community. Before we begin, I would like to take just a moment to tell you about the format for tonight's interactive call. We realize that some on the call will just want to listen, and for those who want to ask a question, please press *3 on your phone, and you'll be transferred to an operator who will take down some quick information. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until you are called upon. So go ahead and press *3 now if you already know your question, and this is the same process to follow throughout the call. If you hear something that generates a question, just press *3. We'd like to answer as many questions as possible. We will limit all callers to only one question, and when it's your turn, I'll call your name and ask you to repeat the question for our live audience. So let's get started. I'm going to turn it over to Dr. Mark Johnson for some opening remarks. Doctor, go ahead.
Good evening. Welcome to today's call, and thank you for joining us. We know that we are in unprecedented times, and we understand the effects, both physical and mental, that a public health event like this can have on our community. Our goal for this call is to provide some practical tips and guidance for maintaining mental health and wellness during the COVID-19 pandemic. We will also share resources available in Jeffco to support our community during this time. And last but not least, we hope to hear from you all about what you are experiencing, how you're feeling, ways you have been coping, or any needs you see in this area. We've partnered with Jefferson Center to lead this conversation. A quick note about logistics. We will have plenty of time for questions and answers and conversation during the call. If you already know your question or think of one as we are speaking, please press *3 on your telephone keypad and you will be transferred to an operator who will take down some basic information. So press *3 on your keypad to ask a question, and we will answer following our short presentation. I'll start off by providing a brief update on COVID-19 in Jefferson County. As of 3:00 p.m. today, we have had a total of 673 cases of COVID-19 in Jefferson County. Unfortunately, 25 Jefferson County residents have died from this virus, and 163 have been hospitalized. Jefferson County Public Health has been working diligently with the Centers for Disease Control and Prevention, the Colorado Department of Public Health and Environment, the Jefferson County Sheriff's Office of Emergency Management, and many, many other partners across the county to stop the spread of COVID-19. We have been implementing and enforcing policies such as the stay-at-home order to ensure our community is following critical social distancing practices. We're working to ensure we have enough personal protective equipment for our healthcare workers and others on the front lines. We're following Centers for Disease Control guidance, conducting investigations around positive cases, and we're supporting community partners in meeting basic human needs of our community, such as access to food, housing, child care, and mental health supports. We're working to keep our community and partners informed on ways to stay healthy and up to the latest information. Based on the current models, we expect a peak in cases in mid-April. These next several weeks are critical to our response, and we need everyone to do their part now more than ever. I will reiterate that it takes everyone doing their part to stop the spread of this virus. That means staying home unless absolutely critical, staying at least 6 feet away from others who do not live in your home at all times, wearing a cloth face covering when you must leave your house, and being diligent about washing your hands. Finally, I'll also note that we have a member of our Board of County Commissioners on the call with us tonight, Commissioner Casey Tighe. Commissioner Tighe is here to listen to the conversation and the concerns and needs of our community. I'll give Casey a moment to introduce himself. We'll take some questions, and then Jefferson Center will lead us in our mental health conversation. Commissioner Tighe?
Yes, thank you, Dr. Johnson. I'm Casey Tighe, one of the three members of the Board of County Commissioners, and I want to thank the Jefferson Center and the Jefferson County Public Health Office for hosting this important conversation. All the county commissioners want to hear from you this evening. This is a very important topic. Maintaining mental wellness during these times of stress is important for all of us. I know this has been a stressful time for me and my family, but we've been able to get through this with the support of the community. And I want to listen to what your concerns are, and I want to hear from the community as far as what you're doing to stay mentally healthy and physically healthy. Dr. Johnson, I want to thank you for your leadership during this difficult time. It's made a big difference to the community. Again, I'm looking forward to hearing the conversations that we're having today, and we will continue to do everything we can to support the community in this difficult time. Thank you.
All right. Thank you, Dr. Johnson and Commissioner Tighe. Now let's start with some questions. And as a reminder, you can participate in the discussion by pressing *3 on your phone. You'll be transferred to an operator who will take down some basic information and get you in the queue. And again, that's *3 on your phone. So our first question comes from Russell. Russell, go right ahead. Russell, you're live with our audience. Go right ahead. All right, let's go next. We lost Russell. Let's go to Tina. Tina, what's your question?
Yes. Thank you for holding this forum. My name is Tina, and I have a question regarding testing. I think the testing is very stressful, and thinking about it, when you think about what the government says is happening, what's truly happening, what doctors are reporting around the test, that they're 63% in, false negatives, the inability to be retested, who's being tested, other than those that are in the hospital, when clearly there are ill people not being tested. I guess that is a stressful experience, not understanding, because the county was testing, now they're not testing. Are those tests older tests? I mean, what is the issue around the testing, and will it be that the doctors will be able to test rather than going to the hospital? Nobody wants to go there. There's sick people there. There are dying people there. I mean, is there not another way? Is the county not addressing this?
Thank you, Tina. This is Dr. Johnson. Testing has been one of the most frustrating parts of this whole response, and I share your concerns about it. As far as the fear of getting tested or the concerns about the positivity rates and the negativity rates and where can you get tested, we are beginning to see that there is some improvement in that area. Originally, you did have to get tested at the State Health Department. That test was sent to Atlanta, to the Centers for Disease Control. Then we had testing here at the state laboratory. Now we actually have testing that's being done at some of the hospitals as well as some of the private laboratories that we have in the area. So many more tests are being able to be done, and the test results are coming back much quicker than they were originally. We also have had the FDA, the Food and Drug Administration, has used their emergency use authorization to expand the production of tests and the invention of tests by a number of different entities. So now we are struggling a little bit with having many tests out there. Some of them are more credible than others. When you take a test, there's two things you want to know for sure. One is, does this test, if it says I'm positive, am I really positive? And if it says I'm negative, am I really negative? The credibility of the test is still a bit in question, although the FDA is getting better at approving and authorizing some of the tests that are out there. And these tests now are in hospitals and in some physicians' offices and urgent care centers and other places, so that it is much easier to find a place to get a test. Those tests, we believe, are becoming more credible, and that as we move forward, we will have a much better understanding both of who has the disease and who has had the disease in the past, so that we can do a better job of case identifying as well as contact tracing. But I share your concerns that it has been very frustrating up to this point, but we think we're beginning to turn the corner on that. Thank you again.
All right. Thank you, Doctor. Gil is next. Go ahead.
Yes. Hi. Thank you very much for having this. My question is how do they test for COVID? Second, how do the tests separate out COVID from other viruses, and not show that the virus is just something that like from another someone having another flu or H1N1? That's my question.
Thank you very much for your question. That's an excellent question. What the test that has been done up to this point is called a Pcr test, and what it does is it takes the RNA that is in the virus, and this is done for many different viruses, but it takes the RNA from a specific virus, and then it basically reproduces that and makes it into DNA so that it can check exactly to see what is this virus. Is this the COVID virus? Is it an influenza virus? Is it a hepatitis virus? Whatever. But the reproduction of that then helps them to determine exactly that this is a piece of a virus that is coming from the coronavirus that is causing COVID-19. They're very, very sensitive as far as being able to find the virus that and identify it to the COVID-19. The tests that are now beginning to come out, and the ones that we'll be using more and more as we move forward, are called serology tests. And what they do is they take a bit of blood from the person, and then they check for antibodies in the blood. Antibody is something that your body makes once it has been exposed to something that's foreign to it to help fight it off. And there are basically two types of antibodies. One that spikes right away when you're sick, and then one that spikes a little bit later after you've been sick. So that's the one I was talking about that we'll be using later to try to check to see, did you have it in the past or do you have it right now? Those immune globulin, IgM and IgG tests can tell us that. So those are the two main different kinds of tests that are being used. Up to now, we basically have been looking at the RNA, the piece inside the virus that actually causes the virus to be what it is. Now we're beginning to do more tests that tell us what the body's response to that has been and whether it is acute or whether you're convalescing a bit further down from the disease.
All right, let's go to a question from Linda. Linda, go ahead.
Hi. I'm going to talk on a little different vein. I am older. I may not sound like it, but my fiance just became my fiance. I'm talking about love in the time of COVID. I might write a book. So we love each other very much. We are older, and I think everything has become crystal clear to both of us that we want to spend the rest of our lives together, how many days that we have. But and we will be married. We are limiting contact. We're both still working, but he works on a ranch and I work in senior care. So I only have one client right now.
Linda, Linda, congratulations on your engagement. Go ahead with your question.
I want to know, what are the obstacles we face? How do you get married in this time of COVID? How do you apply for a license? And how do we keep each other sane?
Linda, this is Casey Ty, and I think we can answer your questions. Our clerk recorder, George Stern, was updating us on a call today, and he said that they do have the ability to issue marriage licenses now. I don't know the specifics of how it works, but you can call the clerk recorder's office at 303-271-8121, or you can visit the website, jeffco.us. And they've got instructions there on how to apply for a marriage license, and so people can still get married. And congratulations.
All right, great questions so far. Don't forget to press *3 on your phone if you'd like to get in the queue. I'd now like to turn the call over to Kiara Kunzler, who is CEO of Jefferson Center. Kiara, go ahead.
Hi, everyone. Thank you. I'm Dr. Pcr Kunzler. I'm the CEO of Jefferson Center, and I'm joined by other mental health experts from our team to answer questions that you have related to mental health. For those of you that don't know, Jefferson Center is a nonprofit community mental health center, and we've been serving Jefferson County and the Front Range for over 60 years. We provide mental health and substance use services to people of all ages and all walks of life. We've partnered with the community to come through many crises over the years and are dedicated to supporting you and your mental health during this time. So first, I'd like to give you some information on how to access services and resources that you may need, and then spend some time talking through how to best manage your mental health and well-being, and make sure you walk away from this call with some action steps and how to take care of yourself during this time. So as Dr. Johnson mentioned, we are currently facing an unprecedented public health crisis, and focusing on our mental health is incredibly important in times like these, as it always is. We know that our mental health and our emotional well-being is critical to our overall health and our ability to cope. So it's important to note that during these unusual and unprecedented times, that feelings of anxiety and feelings of stress and worry about the unknown are really natural reactions to what we are experiencing collectively. But it's still very important to take these feelings seriously and to get the support that you need. So we want you to know that Jefferson Center's here. We're available. If you need to talk to someone about mental health concerns or substance use, we're open and accepting new patients. We are offering most of our services through phone or telehealth appointments via video chat. We've adapted to develop some innovative ways to provide remote care so that we can serve clients at their homes directly to the homes of our clinicians and providers. We do also have essential services that are open and available for walk-ins. So this includes our 24/7 crisis walk-in services, as well as withdrawal management for people needing a detox from substances. And we continue to offer resource navigation as well for anyone needing support or finding or accessing benefits or community resources that might be helpful during this time. So just again to reiterate that our crisis services are available 24/7. You can call us at 303-425-0300 or call the statewide crisis line. That number is 844-493-8255. And you can also visit our website at jcmh.org. Stay-at-home orders that the governor has put in place will last at least until April 26th, and we've all had to shift how we go about our daily lives. For some of us, this may be seen as a temporary disruption or a burden in our lives, or perhaps even positively as a time to slow down and connect with family at home. But for others, this really jeopardizes the basic building blocks of life, things like access to food, unemployment, accessing shelter. This time of social distancing really limits our ability to connect with others. Social connection is so important, and we rely on that for our mental and emotional well-being. So whether you are feeling generally okay during this time or whether you're struggling, it's really common to have fluctuation in your mood depending on the day. So some days you may feel relatively normal, and other days you may feel more irritable or anxious, or even have some symptoms or feelings of depression. For people that have mental health disorders or addictions, this disruption to daily structure and the support system that they've built may feel completely overwhelming. And for family members as well who are caring for individuals with mental health conditions, this time can also feel incredibly overwhelming as they have lost the structure and the support that their loved one or family member had previously and are having to take on more of the caretaking than before without having the much-needed breaks for self-care for themselves. For all of us, this loss of social connection can be one of the most difficult challenges during this pandemic. We know from quite a bit of research at this point that social connectedness is just as basic a need and as important to health as food and shelter. The lack of social connection can lead to higher rates of anxiety and depression, aggression and violence, and there's actually a larger impact on physical health and mortality from social isolation than there is from obesity, smoking, and high blood pressure combined. So there are several wellness tips that we'll talk about in just a minute, but one of the most important foundations to get us through this time is the recognition of our own resilience. So resilience is a word that we use frequently in the mental health field to convey the capacity of humans to recover or adjust in the face of extreme stress. And in trying to understand more about resilience during this time and how to cultivate it, I discovered that the original definition really came out of the field of physics and was defined as the power or ability to return to the original form after being bent, compressed, or stretched. I think most of us in the world right now can relate to this definition. I know that I've certainly felt stretched and bent by the current situation, and to the point where some of us may feel close to breaking during this time. So much seems out of our control as we try to balance competing demands in our lives, our children, our family, our employment, and taking care of ourselves. So it's so important that we have faith in our capacity for resilience and our ability to bounce back from these challenging circumstances. So trusting in our own resilience doesn't mean that we stay completely, consistently hopeful or optimistic. It's impossible during this time, I think, to stay in that positive place. So there will be moments or days or weeks where we feel overwhelmed or anxious or depressed and feel like we might be unable to return to that state. It is so critically important that we invite patience with ourselves and with those around us, to have acceptance and hope that our resilience will allow us to return once again to a state of well-being. All of this requires that we have acceptance of what is out of our control and be able to move in and out of moments of stress with more ease and recognizing that this moment will pass, which is very hard to do in the moment, but it's a practice that is possible. So when you notice that you're struggling, have patience with yourself. Try to avoid being critical and try not to talk yourself out of it in that moment. Try to have acceptance and patience. And also take the next step to do something to take care of yourself. Again, we want to make sure that you walk away with some tips and tools to take care of your mental health during this time. But before we jump into some specific concrete tools, let's take a break for any questions that might have come up.
All right, thank you. Let's go to Julie first. Julie, what's your question tonight?
Hi. I wondered if the Mental Health Center could offer some small support groups, like maybe 6 to 10 people. I think as an individual who's extremely isolated, I don't actually see a person's face, and it's not enough just to have one-on-one, like with a therapist or something.
Thanks for that question, Julie. This is Amy Miller. I'm the Senior Services Manager at Jefferson Center. That's a great point. Jefferson Center, we've been working hard to transition how we've been delivering both individual therapy and group therapy. So we're not offering that specific type of group just yet, but there are some really fantastic resources out in the community. I would encourage you to check out our website as well as the Jefferson County Public Library's website. We have a fantastic partnership with them where we are delivering more services by phone. So every Thursday morning at 10 a.m., we have a call-in meditation where you can call in and have one of our therapists take you through a guided meditation, and there's time for discussion and connection afterwards. So you can access that by calling 303-502-5189 at 10 o'clock on Thursday morning. There's also some great organizations that are doing telephonic check-ins. So specific to older adults, they're checking in on older adults, and if you're not an older adult, you could volunteer to help out with that. And right now, volunteering is a great way to stay connected and get support. So reaching out to a little help if you're interested in that type of service, and then certainly taking advantage of the different hotlines that are out there. Certainly our crisis services line. There's also a friendship line from the Institute on Aging out of San Francisco. So there's definitely lots of good options for telephonic support, and we'll certainly look into the suggestion about specific support groups further.
All right, Chad is next. Go ahead with your question.
Okay, so I had a pretty simple question. I'm curious as to what are the total resources for Jefferson County residents to get any type of mental health that is not tolerable, simply getting with the fact that can't be social.
That unfortunately, your phone is really breaking up. So I'm going to jump in and have someone.
Is this better? Can you hear me now?
How's That's better. Go ahead.
Okay, so the resources are.
All right. Why don't someone from Jefferson Center jump in? What other resources are
Sure,
available?
Chad, this is Heather Trish with Jefferson Center for Mental Health, and I'm a clinical director there. And I think I understand your question to be what mental health resources are available to residents of Jefferson County at this time. That's a great question, and I'm so glad you asked it because there are so many resources that we have just at Jefferson Center for Mental Health. We have individual therapy to offer. We are offering virtual groups. I will say the specific types of therapies that we provide at Jefferson Center include cognitive behavioral therapy, EMDR, DBT, motivational interviewing. We offer substance abuse services, withdrawal management. We have a crisis walk-in center at 48th and Wadsworth. There are a variety of services that are available currently to you. We offer medication services, and we have 2 pharmacies. So there's really a range, and the best way to engage with mental health connection is to call us at 303-425-0300 and just tell the person who answers what you're looking for, and they'll ask you some questions, and then they'll get you to the right program and services that we offer at Jefferson Center. So please call and please connect.
Great questions. Let's go next to Elizabeth. Elizabeth, go ahead.
Hi, my name's Elizabeth. I have 2 questions and then want to clarify what the Thursday at 10 a.m. meditation call-in number is. I didn't quite catch that. But my main question talks about trauma. And I feel like in this time, we're experiencing trauma on a wide scale. And what are just some techniques that we can do when we have those flare-ups of emotions, whether they're anxiety or depression or just like mass amounts of tears and everything seems to be going wrong? Because I'm experiencing just a lot of gratitude and then a ton of fear and other things. And then my other question has to do with blood types, and if there are specific blood types that are more susceptible to COVID-19. Thank you.
Elizabeth, this is Heather Trish again from Jefferson Center, and you asked specifically about trauma, and I work with the trauma services team at Jefferson Center, and what you're describing is just so so normal and so common, right? One time your emotions feel really, really up, and then at other times you feel really, really down. There's kind of this wave that you're riding of emotionality. So what can you do? There are a lot of basic things that you can do just sitting at your home, right? You can do deep breathing, you can do stretching, you can call a friend, you can connect to things that you enjoy within this world of physical distancing, not social distancing. That's a very different thing. You can exercise. Exercise benefits are incredible. That's something that I personally use to manage some of my mental health challenges during this time, and it's incredibly beneficial. So there are the therapies, there are the medications, but there are a lot of things that you can tune into in your life already, probably in the four walls of your home, to use those to feel better. I know a lot of people are watching a lot of TV, but that's certainly not the only thing to do. And I would also just recommend limiting the access to the news. If you're finding that sometimes that increases your anxiety, you have the choice to turn that off, right? Or choose to get your news from a place where you feel like you're just getting the news and not kind of the hype. So anything that really speaks to you in terms of stabilizing your mood and helping you feel better, check in with yourself and notice what is working and what is not, and try to do a little bit more of what is working.
Elizabeth, this
right.
is Dr. Johnson.
Oh, doctor, go ahead.
I'll try to answer your question about blood typing. One of the analogies that I find useful is called the shotgun analogy. If you stand 20 yards away from the side of a barn and shoot a shotgun, the pellets will be shot out all over the place. But if you get very close to the wall of the barn, you may find 3 pellets that are very close together. And you may think, oh, here's where they were shooting it. They were shooting it right where these 3 pellets are close together. That's kind of where we are now with COVID. We're finding there are a lot of studies being done. They're looking close to see what are the associations with this disease, and they may find 3 pellets together. They may find that here are 3 or 4 people that have the same blood type, but if you back up 20 yards, you find that actually they were shooting it at the whole place and they just happened to end up there. We don't know at this point whether there are some blood types that actually are more susceptible or whether it was just happened to find those 3 or 4 that were together that had the same blood type. So at this point, although there have been some studies that do show that, I don't know that it really makes, it truly is an association that we can say does make somebody more susceptible, and I don't think anybody can say yet what that is.
All right. Thank you, Doctor. Shelley, you're next. Go ahead. Hi, Shelley. You're live with our audience. You may have your phone muted. All right. Well, Shelley wanted to ask about some anxiety her daughter's having. Someone want to take that?
Yeah, hi, Shelley, thanks for your question. I'm sorry that we couldn't connect. This is Kristen Tomey. I also work at Jefferson Center and with the navigation team, and we'd be happy to help your daughter connect with services for anxiety. Heather did a great job of outlining a lot of what those different services are, and we do serve all ages and all different types of, if folks are looking for wellness services or they want a group or they want to do CBT or more intensive therapy, we are still offering that range of services just through telephonic or video support options. So please give us a call. Again, that number is 303-425-0300, or you can always email us at info@jcmh.org. Thank you.
All right. Next is Jill. Jill, what's your question?
I'm going to just tell you your call wasn't relevant. No, she's not me.
Hi, Jill. You're live on the phone.
Yes, my question was similar to the other ladies. I have a daughter who was a little fearful before this was going on and had actually been getting better with her mental health. Right now, everything she's hearing is that she's not going back to school. She's going into high school next year from junior high or middle school. And so my question is like, what can we do to counsel the children that are going through this? Because I've tried to assure her that we're safe financially, we're safe food-wise, all of that good stuff, but she is still so fearful, and she's afraid to go out, and she was afraid to sort of go out before, so I want to make sure this doesn't exacerbate anything that was going on with her before. Hello?
Hi there. This is Julie Dawson, and I work with the family and children, children and families at Jefferson Center. And what you're describing it's a great question, and I think we can generalize it for your high schooler, but also for even middle school and younger kids. Some kids are just, generally anxious, and then we added pandemic on top of it, and it can really intensify things. And so I think what you're describing is really a great start. You're normalizing it for her. You're telling her that in terms of financial situations, your family is stable. I think modeling for her is another really good way of just showing her that things are okay. Wearing a mask when you're going out, and kind of modeling for her the things that we'll all be doing, perhaps even after April 27th. So I think making ourselves available to our children is tough on parents, but also really needed. Kids sometimes don't say, "Hey, Mom, I'm really anxious about this." They might say, "Hey, can you play with me?" Or, "Mom, can we go take a walk?" Or, "Can I make dinner with you?" And so I think giving the most that we can to our kids is the best route. And certainly, keeping an eye on it and keeping a dialogue with your daughter about her experience of anxiety is really the best thing that you can do as a parent. And if it becomes evident to you that her symptoms are really increasing and you want to reach out, I encourage you to do so. Just to even do an assessment in terms of where her mental health is. And again, you can do that with us here at Jefferson Center. And I know the number's been provided, but I'll provide it again. It's the 303-425-0300. So thank you. That's a great question for many parents that are on the line.
All right, really terrific questions so far. We'll get back to questions in just a minute, but I'm going to kick the call back over to Kiara for some additional comments.
Thank you. I want to echo just incredible questions, and hopefully this is providing some information on where to start. I think, in response to Jill's last question as well, the lack of control that we feel during this time, whether we're adults or children, can really lead to that sense of anxiety. And so I'd like to talk through a few tips related to taking care of our mental health and well-being during this time to give us as much of a sense of control as we can and be able to make choices and have that control, which can help mitigate some of those symptoms of anxiety as well. So the first thing is to create a daily routine. So when we're taken out of our normal daily routine and placed in this unusual situation, it becomes really important to create a new normal routine. So getting up at the same time every morning, going to bed at the same time every night makes a big difference in terms of mental and physical health. Taking a walk and getting outside every day, just feeling that sunshine on your face makes a big difference as well. And spending some time connecting with people each day. So whether this is by phone or email or video chat, or simply saying hello to someone when you're out for a walk, those types of things can be very helpful to incorporate into the daily routine. Also making a plan and daily routine for our kids and children or others that you're caring for. So creating a really set schedule that has a routine based on regular meals, chores, physical activity, creative activities. Certainly some screen time is okay for kids during this period, and wrapping that into the online learning as well really can give them a sense of routine and predictability. Make sure that you're staying connected, and by staying connected, you can also be giving to others, which feels rewarding in itself. So a question that we're getting a lot right now is how do we support social connectedness for those who need it most when we're practicing effective social distancing. So do what you can to take that extra step to engage and connect with others. If you have a loved one, a family member, a friend who might be far away, they might be down the street, but you haven't been able to see them, make that phone call that you've been meaning to make. You might smile at others when you're out for walking your dog, send an encouraging message to someone else to just let them know that you're there. Those kinds of acts of spreading kindness to others can have enormous benefits for yourself as well as the person that you're giving that kindness to. Heather mentioned this before, but really try to get your information from good sources. So social media can be a place to connect, but it can also be a place where information may not be as reliable, or it may be more fear-based than some other reliable sources. So make sure you're connecting with the Jefferson County Public Health Department, the Colorado Public Health Department, the CDC, the World Health Organization. Those are some great sources for accurate information during this time. And if you're feeling stressed or anxious after spending time on social media or watching the news, just really try to limit the time that you spend on those. Give yourself a break from that extra stimulation. Try to make the most of downtime. So when possible, you might try reframing your time at home or away from work as an opportunity to get some things done around the house that you never seem to have the time to do otherwise. Potentially reading books that you've been meaning to read, or organizational projects. If you're feeling healthy, you might try to create a new workout routine or try a new recipe. Also, if you're healthy and able to volunteer, there are many organizations right now who are relying on volunteers and really looking for people to help with telephone support to the people that they're serving in the community. So is there something new that you can engage in during this time that makes you feel like you're contributing in a different way? Be sure to manage your stress. So we talked about some of this in response to the questions as well, but strategies around mindfulness, deep breathing, even if it is only for 1 minute at a time. 5 minutes is even better, but just counting your breaths, 5 counts in and 5 counts out for a few minutes in the midst of your day can make a huge difference. Check out guided meditations. A lot of folks are offering free resources right now on mindfulness and meditations, so I would encourage folks to take advantage of that. And be sure to just practice that patience with yourself. When you are stressed or when you are irritable or having a hard time coping, be patient with yourself and take that pause that you need to just give yourself some time and space. It's also really important to notice if mental health symptoms worsen for you or loved ones. So we've been talking about a lot of strategies that really are helpful for everyone during this time. But sometimes, the sort of normal feelings of anxiety and stress during this time can turn into something more serious. And so it's really important to notice that for yourself or a loved one. So if you seem to be in a funk that you just can't seem to come out of, perhaps you're feeling down or lonely, not finding pleasure in activities throughout the day, feeling hopeless, consistently irritable, or if children are acting out a lot more than normal or unable to be calmed or soothed, those could be signs that something is needing more attention. Other signs to look for if you or loved ones are finding yourself avoiding contact or avoiding conversations with others or isolating or experiencing a significant change in attitude or behavior, just acting different than the norm. All of these things could be signs of depression or another mental health disorder. So please be sure you notice those warning signs for yourself and your family, and reach out and ask for resources like we identified today, even if it's just to ask a question or run it by someone to see if more intensive services are appropriate in your situation. I think we want to take the rest of the time for some more questions, and certainly can get a little bit more specific on those tips if folks would like to dig in further.
All right, thank you very much. Let's start with a question submitted online from Steve. He says, my sister is drinking much more than she ever has in the past. I don't know if it's out of boredom or stress. When should I be concerned that it is a problem? Who'd like to take that?
I'll take that. My name is Lauren Reedy. I'm with Jefferson Center in the Substance Use Services Department. So that's a great question right now. Certainly at this time, it can bring up more substance use than normal, both for people who have addictions in the past or currently, and for people who don't. But I would say if you're getting concerned about her use and you feel like it's a little bit too much, and if she's getting concerned about it as well, you guys can always give us a call. The number again is 303-425-0300. And we're happy to talk with her over the phone and kind of figure out if she wants to come in and meet with someone and talk more about it. But typically with drinking, if someone's drinking every day and it's more than 1 or 2 drinks a day, that typically is gonna signal that it's somewhat of a problem at this time. Again, it's sort of a difficult time right now, and I think a lot of people are going to be potentially using substances a little bit more than in normal times. But certainly if you're noticing that it's getting out of hand, or she's feeling like there's a problem with it, or you have concerns about it, definitely have her reach out for help, or you can reach out and we can assist you as well.
All right, next up is Karen. Karen, go ahead with your.
Hi, so I wanted to get more information, more than anything, on how I could register, or if it's okay to, I don't know, I live in apartment complexes, maybe like if I want to be kind of like a support for some of the members of my community, is it okay for me to contact them via a note on their door? Do I let my main office know that I am willing to help, whether somebody just wants to talk out of boredom, or if and then I also heard that there's like volunteering opportunities to help with that as well. Is there like somewhere I call, or do I need to register, or how does that kind of work?
Sure, that's a great question, Karen. This is Amy Miller with the Senior Services Program. There's certainly, the more informal ways of volunteering that have popped up. I'm seeing a lot of really great neighbor-to-neighbor support on websites like Nextdoor and different Facebook help groups. So as long as you're practicing, the guidelines of social distancing and washing your hands frequently and, wearing a mask out in public, that can be a really great way to support older adults who may be more at risk for going out and doing their daily shopping and things like that. If you're looking for more formalized ways of volunteering, the governor did set up Help Colorado Now, which is a website where you can volunteer to sign up. And that website is covrn.com. And then locally, specifically to the elderly, A Little Help is a fantastic organization that is doing the friendly calls and the check-ins and the grocery deliveries and pharmacy prescription pickup. So A Little Help is a great organization. The governor's website is a fantastic resource. And then I did want to repeat the call-in number for the weekly meditation on Thursday mornings from 10 to 10:30. You don't have to register. You can join by calling 303-502-5189 at 10 o'clock on Thursday morning. Thank you.
All right, we're running short of time, so I'm going to ask everyone to be very quick when you ask your question so we can get to as many people as possible. Ada, you're next.
Hi. I am concerned about something that came up during Governor Polis's recent address to the state, and he noted that he would not take any questions about guns, and that it had been previously mentioned there was a recent lawsuit from the NRA. I'm concerned about this for obvious reasons because of concealed carry permits requests going up and so forth, but I know they're not going to shoot the virus, and I'm very concerned about some abused women being threatened and child abuse, and I have a friend, an abused woman, that I can't get in touch with anymore. So I'm wondering...
Commissioner, do you want to talk a little bit about public safety during this crazy time?
Yes, I think everyone's concerned that people might feel trapped in abusive situations because of this situation with COVID. And we want people to know that there are options and that they can seek help. I know Ralston House is committed to staying open, and their number is 720-898-6741. And if people are concerned about their safety, they can still call law enforcement. But there are options. You don't have to stay in an abusive relationship. So please call if you need help. And I do appreciate that one was checking in with their friend. Please continue to check in on your neighbors to make sure that they're being taken care of. But there are options.
All right, Kim, you're next. Go ahead.
Yeah, my question seems a little simple, but it's regarding wearing masks. I've seen people outside riding their bikes with masks on by themselves. And then I went to the store yesterday, and 60% of the people in the store had no protection, including the store workers. Can somebody clarify for me when you should be wearing the mask, and how do we address the many, many people who are just disregarding the whole thing? I was very angry. I didn't do anything about it, but I was just really taken back by it.
Yeah, thank you, Kim. This is Dr. Johnson again. The wearing of masks is twofold. One is to protect yourself, and one is to protect others if you happen to be infective. Unfortunately, or fortunately, we live in a country where we do not have a lot of restrictions that are mandated with law enforcement behind it, and this is one of those where the strongest recommendations are being given. We are saying this is the best thing you can do for public health, both for your own health and for the health of those with whom you come in contact, particularly if you're in an area of closed space like in a grocery store or you're near someone. So for your own health and well-being, wear a mask. There are a number of people who have chosen not to do that for a number of reasons. They are putting themselves and their loved ones at risk, but we do not have at this point any enforcement that is going to force them to wear that. It is just a very strong public health recommendation. So you can be upset that people aren't doing it because they are putting you at risk, but again, there will be nobody enforcing that, at least at this point, wearing of masks.
All right, Michael is next. Go ahead.
Hi, I'd like to know what the panel considers to be good news or things to be hopeful about the response to the COVID pandemic locally.
Yeah, I'll be happy to take that. This is Dr. Johnson again. I do think we have some good news. I think we're beginning to see the number of new cases flatten out a bit, meaning we're not having as many new cases every day as we were having originally. What that's doing is bending the curve so that we are beginning to see that perhaps the social distancing and the restrictions that we've put in place are making a difference. Unfortunately, and this is kind of complicated to figure out, but what we're doing now is we are living with the results of the last 2 weeks. So we're beginning, because that's the incubation period for the infection. So we're now seeing people in the hospitals, seeing deaths, seeing infections from people who got infected 2 weeks ago. So although it is beginning to curve, we still think that for the next 2 weeks we're probably going to see increasing cases, and that there will be some very serious cases, but there is light at the end of the tunnel for the case rate. Also, as I mentioned earlier, it's good news that we're beginning to see more testing available, and that is going to help us both in surveillance, figuring out where are the hot spots, where do we need to focus on case contacts and those kinds of things. So that is also good news. So I think there is good news. We also are beginning to see more people recover and go home from the hospital. So there is good news. It's not all bad news, but it does not mean yet that we can let up on our diligence of trying to prevent new cases.
Kiara, do you want to add something?
Sure. I just, thinking about what has been positive during this time, we are seeing such an incredible community response. People are coming out of their normal routine to really connect with other people in new and creative ways. I think as you take walk in your community, even at a distance, people are saying hello to each other, giving that smile, offering toilet paper or food to their neighbors, and connecting in a way that we really haven't before. So this truly is a time for resilience, not only within ourselves, but a collective resilience as a community. And often, once we get through something like this together, we feel stronger, we feel more capable and more able to handle whatever comes after this. And so I think that is absolutely the positive that we will take away from this experience once we get through the darkness and see that light at the end of the tunnel.
All right. I'm going to ask Dr. Johnson if he has any quick final remarks.
Yes, I want to thank all of our callers for the time and the questions that you have brought. Hopefully that has helped a lot of people. I also want to thank all of the professionals from Jefferson Center, Commissioner Ty, and all the others who have made this telephone town hall work so well tonight. We know these are very hard times and trying times. We know that there are many questions that we don't have great answers for. Thankfully, though, we live in a county, Jefferson County, which is blessed with a rich history of folks working together and helping those who need it the most. And we do have many resources that will help us through this crisis. As I mentioned earlier, we believe we're beginning to see some signs of improvement, but we ask all of you to continue to do your part to keep this virus from spreading. You know what those steps are. Stay at home as much as possible. Observe social distancing. Cover your face with a mask when you're out in public. Wash your hands, cough or sneeze into the crook of your elbow. Don't touch your face as much as possible, and keep in virtual touch with the support community that you rely on. Thank you very much.
All right. Thank you, Doctor. We have come to the end of the telephone town hall tonight, and we're sorry if we didn't get to your question, but you can still leave a message or a question at the end of the call, so just stay on the line, and you'll be directed to a voicemail system. I also want to repeat the website for Jefferson Center. Lots of great resources there. It's jcmh.org. On behalf of Jefferson County Public Health and the Jefferson Center, thank you, stay healthy, and good night.